So this is chapter 28, just some highlights about leadership, management, and delegating. So by the end of this presentation, and certainly this doesn't encompass everything, I can't read the whole chapter to you, so I hope that you read the assigned chapter, but hopefully at the end of this presentation that you will be able to compare and contrast different leadership styles, discuss the roles and functions of nurse managers, describe the characteristics of tasks appropriate to delegate to unlicensed and licensed assistive personnel, and list the 5 rights of delegation. So as a nurse, there are many roles that nurses have as professionals. Leadership, management, and delegation are certainly 3 of those roles. We've already identified that we're advocates for our patients, that we are team members, we are teachers, we are sometimes almost like a counselor. There are just many roles that nurses have, but leadership, management, and delegation are very consistent with that of a professional nurse. So your book talks about defining a leader, and a leader are definitely people that influence others. They assess effectiveness of care. They also implement evidence-based practice, and as a bachelor's prepared nurse, you will be. The other thing that a leader does, constructs process improvement strategies. So an example of that would be kind of reviewing things that are happening maybe within an organization or on the unit, wherever the leader or nurse is working, just to kind of assess if the systems that are in place are making a positive difference or not. So I'm thinking a lot along the lines of quality and safety. Those things are evaluated. You don't have to be a hired in nurse manager or a hired in designated nurse leader to be in a leadership role on the unit or organization in which you work. Most hospitals, acute care setting, they have something called unit council, and so that's where the nurses and staff that work on that particular unit meet, and they learn to evaluate and improve current strategies and assess best practice and implement best practice and all these things, that terms that you're starting to learn about in your N100 class. These are things that you're actually going to be using and be doing. So sometimes it's difficult to distinguish between leader and manager or leadership and management because sometimes they overlap. Some of the concepts of each of these overlap, and their terms are often interchanged in our culture. But they are different, even though some of the concepts overlap. Both of them, a nurse as a leader and manager, which is what you are kind of going to be doing with your patients. You're going to influence others to work together to accomplish a specific goal. So maybe that's the unlicensed assistive personnel, your LPNs, your coworkers, influencing them. We also influence our patients and families to work together to accomplish a specific goal. You're going to be working with your patients to help them achieve optimal outcomes, and we kind of have to use those leadership and management skills to do that. Describes nurses as a leader and manager as a visionary, having outstanding interpersonal skills, being excellent listeners and communicators, being innovative with change, being motivated, being a mentor to other nurses. Don't forget where you come from. Hope you choose to mentor new nurses and facilitate learning. So while there are some leaders that are maybe hired in as a specific leader, most of the time that would be considered a formal leader, where they're appointed by an organization and given specific authority to make decisions. But most of the time, leaders really, they just happen. They're kind of an informal leader. They're not officially appointed. They might be recognized because of the amount of years that they have invested, maybe their age, maybe it's their wisdom, or maybe they've got a great skill set. So you don't have to be the oldest nurse on your unit to be a leader. So uh, a lot of it has to do with personality because you're able to influence others to achieve a goal. So there's many types of leadership styles or traits that would make somebody naturally be meshed as a leader. And these are typically, I say leaders are people that you want to be around. They are definitely hard workers. They listen to what other people have to say, but they're not afraid to speak up and work towards goals. Um, so there's some leadership styles that we'll talk about, and there's also classic leadership theories that are listed in your book. So there are several types of leadership theories and styles, I would say. Authoritarian are the type of people that they're very in control. They use this type of this is the way it has to be done. We need to get the work done this way. Authoritarian is opposite of like listening to what other people have to say. It's this is the way we're going to do things. This is the way we're going to get it done. Democratic encourages group discussion and decision making. So kind of the opposite of authoritarian. It's kind of wants to know what everybody else has to think and maybe even has people vote. Laissez-faire is permissive. So laissez-faire is kind of hands off. So the leader really abstains from leading and lets the workers, or I guess if you're thinking on the leadership management, the subordinates kind of lead themselves. Bureaucratic follows the policies designated by the organization and procedures. Situational is based on what the need is. They're going to assign tasks and make sure that a specific task is accomplished. Charismatic, this type of leader is very a lot of times charismatic. I think of like excited. They really are kind of almost like cheerleaders for the group to get things done. They want to have relationships with the group, but they really like want to like channel their energy to support whatever the mission of the group is. Transactional is based on exchange for some resource. So I think of transactional, you scratch my back, I scratch yours kind of philosophy. Transformational is where you're empowering the group to share in a vision. I'm not sure if after you read some of these things, if you've experienced leadership styles like that, or you've ran into people that are these types of leaders. My specific out of all of these would definitely be the transformational, because with transformational leadership, there's mutual learning, there's mutual influence, and there's mutual benefits from those situations. Shared leadership is where they have the work group that faces different challenges, and sometimes they just kind of share the work. So there's like a shared leadership. Shared governance is attempts to share decision making among group members. And when I talk about unit council at the hospital, when I worked on the floor, I was a member of the unit council, and this was a meeting with the nurse manager and sometimes other managers of other departments, and you had your members of your unit council, and they really did. Your opinion, you were able to weigh it in as decisions were being made, and that was considered by the leadership. And I appreciated that opportunity to be part of that. So sometimes you'll see that different leadership theories kind of mix together, or leaders kind of have a couple different types, but it would be very hard, in my opinion, to be an autocratic and transformational, because transformational is able to empower people. When you're authoritarian, it's kind of like my way or the highway type leadership. So here's a list of characteristics of effective leaders. And again, leaders should pretend to be somebody else. They should have a style that's kind of natural to them, and that's why sometimes leaders naturally evolve, because it's part of their character. Or they've been exposed to different people that were mentors and kind of helped encourage them to develop a leadership style that works well with whatever the task and the people that they're assigned to. Um, Characteristics of effective leaders also include them being able to see how is their leadership affecting other people and also affecting themselves. Again, I feel like that's kind of a transformational style. Energetic. I think that leaders should have a lot of energy. They transformational leaders or effective leaders would be open. They wouldn't be somebody that would have like a closed door policy. Like they'd have an open door policy, welcome people to talk about issues or concerns, facilitate personal relationships, plan and organize activities of the group, being consistent towards group members. So even if you have somebody that maybe you were best friends with before, you're going to treat them just like everybody else. Delegating tasks and responsibility to help develop members' abilities, not just to get tasks performed. So really encouraging others and actually encouraging them to become leaders. Involving members in decisions, demonstrating value to the group members and contributions, encourage creativity. Maybe somebody has a great idea, or you have people that you're working with that have some creative ideas, so encouraging that, getting feedback, and find out how and what ways that they can promote current technology to help get things done. So some of the management functions that are listed here include organizing, directing, and coordinating. So as an organizer, part of this is when you're determining the responsibilities, communicating expectations, and establishing a chain of command, it's really setting up a work environment that's going to be productive. So directing is where the manager is assigning and communicating their expectations, being sure to provide instruction and guidance, so training of the workers, and ongoing decision making. Coordinating is making sure plans are being carried out. I almost think of this more coordinating / evaluating, because you're ensuring the plans are carried out, you're evaluating the outcomes, measuring the results, and finding out what's effective or what's not effective, and enforcing or reinforcing the things that are effective, and definitely wanting to make changes for ineffective ones. The nurse as a delegator. This is something that delegation is something that nurses do. We as nurses can delegate to other nurses. We can delegate to unlicensed assistive personnel, UAPs. Sometimes people call them nursing assistants. And licensed vocational nurses, which are also called, in this state, we refer to them as LPNs, or licensed professional nurses. It is important that you know these 5 rights of delegation. So you need to know that you're delegating the right task to someone, that it's not something that they are not able to do, that they've not been competencied on. So I certainly wouldn't want to go ask an unlicensed assistive personnel to go assess my patient, go do a head-to-toe assessment and document it for me. Or could you go give this IV med? Because that would be out of their scope of practice. So you need to make sure you got the right task for the right person, that it's the right circumstances. So let's say that I have 3 patients and I'm working with an LPN and an unassisted assistive personnel, a UAP, and I have an admission that is very, very sick and maybe has multiple high-risk medications that are being given. That's probably not the patient that I'm going to assign to the LPN. I would assign that to an RN, because many of the things that this patient would need might not be in that LPN scope of practice. So again, the right circumstance, the right person, and the right directions and communication, the right supervision and evaluation. In the end, I mean, the nurse is responsible for delegating the delegatee, if that's a word, the person that is going to go do the task, accepts the responsibility to do it, but in the end, the RN will be responsible for evaluating it and potentially supervising it. So here are some examples of tasks that may and may not be delegated. So this is for an unlicensed assistive personnel, and we're getting used to using this new terminology called a UAP, but taking vital signs, recording intake and output, transferring and ambulating patients, taking care of patients after they've passed away, called postmortem care, bathing, feeding. Some may be able to do G-tube feedings. I honestly, in our hospital, we do not have UAPs that do that, but this might be something if it's dictated by the state rules or your organizational rules. Weighing patients, possibly doing some simple dressing changes, CPR, and again, this is something that's in your book and might be state to state, but suctioning of tracheostomies. That doesn't, I'm more familiar with acute care, which is like a hospital setting, and UAPs cannot do that. However, it depends on the organization. So for any testing purposes you have, these are things that might be able to. Things that cannot be would be an assessment, would be interpretation of data such as lab values, making a nursing diagnosis, making a nursing care plan, evaluating care, care of lines like IVs or central lines. They cannot give IV medications. They cannot put in nasogastric tubes. They cannot teach the patients or clients. They cannot do triage assessments or give telephone advice. So here is a list of principles used by the nurse to determine delegation to unlicensed assistive personnel. I'm going to save my voice and let you take a few moments to read through that, and you can pause this if you'd like to read all those. Some of the main things here are related to safety and outcomes and really good in communication.